Your sciatic nerve is the longest nerve in your body. It begins in your lumbar low back area, travels through both hips, both legs, right down into your feet to the tip of your toes. It gets irritated if your posture is poor. It gets really irritated if your core muscles are weak. It also gets irritated if the range of motion at your joints, elbow, shoulders, knees, ankles, hips, if that range of motion is not up to snuff, your sciatic nerve will let you know. There'll be some kind of pain somewhere. So the exercises I'm going to present to you today will help you either manage the pain you already have or help you prepare your body so you don't get sciatica. Nerves don't stretch. Nerves slide like this as you move about. And if your muscles, bones, ligaments, tendons, fascia, if anything gets in the way of the sliding, you're going to get sciatic pain. So we're going to do an exercise that will allow the sciatic nerve to slide and have a break from whatever is impinging it. Sit on the edge of your chair, knees above your ankles, feet shoulder width apart, hip in neutral. Take your leg out so that your heel is on the ground and the leg is straight and your toe is pointing up. And then as you lift your leg, lean your head back, just your head, not your torso, just your head. And hold it briefly there. And then as you bring your knee into your chest, I want you to try to touch your forehead to your knee. It's not a very big movement, but it's very floss effective. You're flossing your sciatic nerve. So you straighten your leg, heel down, toe pointing to the nose, and as you lift it up, you put your head back. Just your head, not your upper body. Briefly hold it there, and then as you bring your knee in toward your chest, you bring your forehead to your knee. Let's do it one more time. Straighten the leg, bring it up a little bit, point your toe to your nose, lean your head back, and then knee to forehead. Good, and briefly hold it. Don't move too fast. Let's try the other side. Straighten the leg, point the toe to the nose, and as you lift it up, put your head back. Then bring your knee to your forehead. Again, straighten the leg, lift the leg, head back. Knee to forehead. And one more time. I'm just doing it 3 times on each side. You could do it more if your pain is really bothering you. And you could do it several times a day. Just take your time and try to do it right. The sit to stand exercise will help your whole body. It'll keep everything strong so that your sciatic nerve won't even be noticed. I'm sitting in a neutral position, which means my hips are not forward and not back. You can feel that in my low back. I'm in a nice neutral, good posture position. My feet are shoulder width apart. My knees are above my ankles. The chair is nice and sturdy, it's not going anywhere. Take my legs and just slide them back a little tiny bit, just a little bit. Turn the toes out just a little bit, like that. Sitting up straight, all we're going to do is stand up. So I cross my arms over my torso like this. I lean forward and I push with my lower legs. To do that, I'm using quads, hamstrings, lower legs, good ankles, bum muscles, holy cats. And my back's getting a good workout too. So let's go back down, but let's go down super slow. Where's the chair? Right there. Let's try it again. When you're ready, lean forward, push, and up we get. Not too fast. Check your posture at the top. And when you're ready, slowly go back down. Super slow will make the muscles get stronger, faster. Let's try one more time. Lean, push, up I go. Posture check. Slowly go back down. When you really get good at that, don't go all the way down like I am right now. Just touch your bum and then go back up. Let's try one of those. So I lean forward, push slowly, I'm in control. Check my posture, and then return. But don't sit. Just get your bum almost, there it is, and then back up. And down you go. Sit to stand, powerful exercise. Will help your sciatic problem. To do the heel toe raise, you just need a wall. So I got one here, and I'm going to stand with my back to the wall. I'm out a little bit with my feet, maybe a foot distance out, and my feet are shoulder width apart, toes pointing pretty much straight ahead, and I'm leaning on the wall with my bum. Now I'm going to make sure my shoulder blades are touching. And if I really can do it, I'm going to take my head and I'm going to push it back into the wall too. That might not work depending on how much you've been moving before you do this exercise. It's hard to get your head back and your ears over top of your shoulders. But let's just worry about our feet right now. Okay, so my feet are shoulder width apart and my toes are pretty much pointing straight ahead. And I'm leaning against the wall. And now when I'm ready, I'm just going to lift my toes up off the floor and the balls of my feet. So I'm balancing on my heels and get them up as high as I can get them. And I'm going to hold it right there. And while I'm holding it up there, I think I'll push my chin into my neck and my head into the wall and try to stand up nice and straight on my heels. That's about 10 seconds, right? And then I'm coming down. And I'm going to slide my feet back toward the wall. And when I'm ready, standing up in my best posture possible with my head back into the wall too, I'm going to come up on the balls of my feet. So I'm going to slide my back up the wall. My bum's still touching. My shoulder blades are still touching. And I'm on the balls of my feet and on my toes. Just to show you, if you can't see that well enough, I'll come back down and I'll go back up. And I'll come back down and I'll go back up. You can do that with me. Go down to your heels, up to your toes, down to your heels, sliding up to your toes, up and down the wall. Your bum's touching and your shoulder blades are touching and maybe your head. I know you can't see my head very well. That's because I don't want you to see that it's not touching. It's difficult to get your head back so your ears are over top of your shoulders. I'm just going up and down. Good. Now I'm going to come out one more time and maybe a foot out from the wall and bum touching, shoulder blades touching, head maybe touching, and up come the feet. So I'm balancing on the heels. Hold it there. So when I'm doing my toes, I'm going up and down slowly. And when I'm doing my heels, I'm just holding my feet up. And you're thinking, what's this got to do with the sciatic nerve? Remember, that sciatic nerve starts in your low back, goes through your hips, your legs, right down to the bottom of your feet and out to your toes. So we're trying to keep all that strong so that the sciatic nerve doesn't tell us that we should exercise more with that pain. Is that enough about this one? Sure. Practice that anytime, anywhere. It's time to work the adductors, the abductors, and the adductors, inside, outside thigh. Why? Well, you know, that sciatic nerve, it comes out of your low back, but it really is one giant nerve that's kind of makes a loop through your hips. So it's like not two separate nerves coming down each side of your body. No, it's one giant nerve curving at the back through your hips. And it has a lot to do with your muscles in your legs, of course. And so we want those strong. So I'm just going to stand in my best posture possible, hold on to the counter here, keep my legs really, really stiff and straight, and just take one of them straight out to the side, leading with the ankle, and getting it out there as far as I can. Check my end range of motion as I stand tall. I try not to lean. I just lift it out there and come back down. Let's try the other side. I'll switch around so you can see. Standing up nice and tall, nice straight firm legs. And just take the ankle with the straight leg on the outside there, out as high as you can go. Standing up nice and tall. Working the adductors and the abductors. Let's try it the other way again. So let's go out, hold it briefly and come back. Slowly. Out. I didn't put my foot down. Did you notice that? If you have to put your foot down to rest, go right ahead. I want to work some core balance muscles deep inside my body while I do the adductors and the abductors. There's a few there. Let's try it this way. You can do this anytime, anywhere. Just hold on to something so that your posture stays nice and tall. Focusing on the muscles on the outside thigh and the inside thigh. Getting them strong. Notice I'm not turning my foot out like this. Nope, I'm leading with the ankles. Legs goes out as far as I can get it. Checking my range of motion. I can feel it in my low back, my hips. That sciatic nerve is going. Good for you. Keep all those muscles in your hips strong, and then I won't give you any pain. One more time on this side. Straight out as far as you can go. Briefly hold it. Bring it back slowly. You got that one? Good work. Okay, we're going to rock and roll down on the floor. Now, if you don't want to do this on the floor, you can do it in your bed. But it's more effective if you get down on the floor and do it. Right? So I'm going to show you how to get down and then we'll rock and roll. But just getting down, doing the exercises I'm going to show you and getting back up is the rock and roll package. Okay, here we go. So I'm going to stand here where my mat is. My feet are shoulder width apart. I'm nice and tall. Posture is always powerful. And then I'm going to hinge forward. Didn't do anything with my legs yet except keep them straight. And then when I get hinged like this, upside down looking at the floor, I'm going to bend my legs at the knees until I can touch the floor. And then I'm going to walk out, making room for my knee right there, and take my best knee and put it down, and then my other one. Okay? So now I'm in the table position. So my hands are below my shoulders. If you don't like that, for whatever reason, you can use your fists and you can balance like that. But I prefer my fingers spread and my hands below my shoulders, okay? And my wrists are lined up with my knees, so everything is in a great table position. And all I'm going to do is lean forward a little tiny bit, putting pressure on my wrists, and then slowly lean back, putting pressure on my legs. And then forward and back. A little rock and roll in the table position. There's lots of core muscles in your body, close to your spine, that will allow you to do this properly. And you need to work them. You won't have any sciatic problems if you do this on a regular basis, not just once a week. How about every day? Just a simple rock and roll from the table position. Okay, now I'm going to take my hands out a little further. They're still shoulder width apart, and then I'm going to rock forward. Notice what happens to my lower body. And then I'll rock back. How far back can I go? And that's about it this morning. Let's try that again. Everything's done slowly. You're in the moment, right? You're thinking about your whole body, your position, your posture, what you're working, Well, you're working all those core muscles because you don't want to have sciatica. Good, good, good. Now, maybe I'll take the bottom of my toes anyway, the bottom of my feet there, put them closer together, and then I'll go back further, and neutral, and then back further. Yeah, that's pretty good, that's pretty good. This is kind of like the resting child back here. I can get my knees farther apart if I want to push my hips further back, but this will do for today. Good. So back into the straighten the legs out into the table. So bring my hands below my shoulder again. You could try shifting your weight and lifting your one arm up, getting the arm parallel to the floor, and see how that feels. Say, hey, core muscles deep inside my body, transverse abdominis, multifidus, all those muscles down there. I'm lifting one arm up, and I'm balancing, trying to keep my hand below my shoulder. And you know, if you wanted to, you could straighten one leg. Keep the leg down, just slide it back. Put the knee back and slide the other one. You could try that too. There's lots of things you could do down here. You could even thread the needle. Let's finish with threading the needle. So balancing on one hand, one arm, I stick the other one underneath and check and see what is under my stove there. Let me look under the fridge from this side, see if there's any dust there. Right, that's thread the needle. One more thread the needle and then we're done, we're getting up. We've had enough of this sciatic stuff today. But pick your favorite sciatic exercises that I presented to you and do them on a regular basis, or do them all. Okay, now to get back up, I have to go reverse, right? I take my knee off the ground, put my foot down maybe, and then the other one, so I'm kind of like this, right? My legs are bent, I'm looking at the floor, bring my hands closer to my feet, slide them up, I'm just uncurling. And I'm up. Stand for a minute. Have a great day, everybody.